I'm gonna step right down.
Can I help you?
Yes. This is. Yes. Are you?
We get away and
Okay.
Are we ready?
Yeah, we can go ahead and start.
Okay. All right. Good afternoon, everyone. Thank you all for being here. Um, this is about the Republican heist or tax cut or tax scam 2.0. Co-President Trump and his MAGA Republican allies in the Congress have proposed another tax cut for Trump and his billionaire buddies. They propose they proposed $2 to $4 trillion in permanent tax cuts for billionaires and corporations, and they plan to pay for it by cutting Medicaid, Medicare, Social Security, and SNAP benefits for women and their babies. This is straight up war on poor and regular working people, which will raise the cost of everything, including healthcare and medicine. It will also drive nursing homes and personal care homes like the one we're in today out of business. These are places and people who we depend on to take care of our elderly, many of whom are suffering from dementia. MAGA Republicans want to gut vital programs like Medicaid that help people survive so that they can give billionaires like Elon Musk, Mark Zuckerberg, and Jeff Bezos another big fat tax cut. And with that, it should be understood that we are not going to allow that to happen. We as Democrats will not allow that to happen. I'm proud to be here with a group of folks who are going to speak to you next. Nadine Johnson is the director of Care One Franchise Incorporated, and I'm going to ask her to come forward to address you. She is the owner of this personal care home.
Well, thank you, Congressman Johnson. Thank you, to my families that are here. Um, we're trying to take light heart of it, but we're talking about an issue that is really important for our community. Our community is aging, and that will continue long until we're gone from here, most of us. And as we age, we're gonna need services that will take care of us when we are no longer able to take care of ourselves. One such service that our seniors benefit from is the Medicaid program. And in Georgia, the Medicaid program has different waivers, and that is how some of our seniors are able to stay into the personal care home by utilizing these waivers. If we should have broad-based cut without different thought processes being put in there and consideration for the financial burden that will be placed on these families, then our homelessness rate will increase. Medicaid has long been viewed as the United States healthcare safety net. So how do you then remove the safety net from a group of persons that are fragile, that are our most uh, senior or aged in the population? If you then remove the safety net, it will then cause our homelessness rate to increase. It is said that in the next 2050, I think the research showed me, is that we would have at least another 30% of our population age. What does that mean? If we're not able to provide services like we're doing right now with the supplement that we get from Medicaid, then how can we house these residents? And then what will we have happen? Elderly and disabled adults needing health care and support will be at a point in their life where eligibility requirements change the way it is being proposed, well, they'll no longer meet that. And as such, not participate in the program. The Medicaid program in Georgia, with the waivers that it has, it provides different barriers. You have CCSP, you have SOURCE, money follow the persons, and persons are able to use these. If we're able to provide continuity of care in this fashion, then our senior and disabled adults will keep them out in the community and out of the nursing home. It costs more to keep them in, to take care of them in the nursing home than to keep them in a community such as ours. But at the same time, we say we provide care from our heart. And if we can only do that for a certain period of time, because after a while, if we're not able to get these supplements, then we're going to go out of business, and then we'll lose the community effect that we're able to keep our seniors in. Changes can happen, and changes may need to happen. But for us, it cannot be just broad-based without thought processes and seeing the families that are here, some of them represented here today, that this program benefits. We must find a way to effect change in a more meaningful, matched manner, where you take into consideration the effects of and the persons that are going to be affected by this. At this time, we have some of our families that are here, that their family member benefit from the Medicaid program or the funding that it provides. And I'm actually very thankful, Congressman Johnson, for highlighting what's happening right now and giving us a voice that you could put faces to what's happening and not just see it as paper, but people, and people will be affected. So thank you. At this time, I'm gonna call on any one of my families that's here that want to say something that their family member benefit from the program.
Hi, my name is Javon Niffen. My mother has received services under Care One for the last 5 years. And I can say personally, I feel my mom would be one of those homeless members if it was not for the assistance we received from Medicaid and the love and personal attention we received from Care One. Our family tried our hardest to take care of my mom without requiring additional assistance. We learned quickly that we didn't have the financial resources, we didn't have the specialization of the personal care homes to take care of her with dementia. She roamed the streets, combative, all those things that jeopardized her safety required me to try to provide the care, which really required me to stay home. I can't afford to stay home. I have to work. So that quickly taught me, oh, I have to find the resources, and Medicaid provided those resources that allowed me to put her in the care, to keep her off the street, because she, for some reason, that's where she preferred to be. She wanted to always escape, but they took her in. These 5 years have been a lifesaver. They found the strengths in her. They love her, despite the challenges that her disability brings. So I have the comfort in knowing that she's cared about. I didn't have to put her in a nursing home. So that personally relieves our family. We have the peace of mind of knowing that she's fully cared for. But without those financial supports in place, she would be homeless, and we would be destined to be homeless as well, because it would require me not to work, and we cannot afford not to work in order to kind of sustain our lifestyle. So that would make another generation susceptible to the financial hardships that the care that she needs provides. So that's my love for and my passion for the Care Ones, the personal care homes that are here. These financial supports are needed. They're in a dire need. Our senior is a prime example of one who truly benefits, and life would be totally different without the service.
Thank you. Do we have any other family members of residents who would like to speak?
actual resident.
Huh?
But
Listen,
she's over there.
well, if she would like to speak, if she
Get
can
her.
make it over here.
Yeah. Can I get her?
You go. Okay, I think our resident has developed a case of shyness.
No, go ahead.
So we will not. Okay, she's gonna come forward. Okay, wonderful.
Where?
Right here. And please state your name for the camera.
I'm not going to steal off one. I'm a lifelong resident of Georgia. And for the last couple of years have lived between two different Care One facilities. And rely heavily on both Medicare and Medicaid. Also, heavily, I have experienced trouble keeping both of those services active. I'm in the middle of a Medicaid battle now. I have an adult handicapped son who also lives in a Care One facility. Big Social Security problem with the amount of his monthly payment. With me currently, the problem is Medicaid, though I've had Social Security issues too. Medicaid lets me know I have been approved. I have a letter from Medicaid stating that. However, it has not ever been keyed into the computer system. No medical providers are interested in my letter. They want to see it in the computer system. I don't know what else to do to get it in the system, short of keying it myself, but I don't have a password. So that probably won't work.
Well, maybe Elon Musk and his team,
Oh, my goodness.
and you're worried that
Okay.
they'll be able to
Well, I'm
key
good
it in
now.
for you.
You said the wrong thing. But thank you so
But
much.
thank you. Those are the kinds of things that
You wanna stay over here?
my constituent services staff at my district office help people with every day. And so we'd be happy to help you with that, with your matters and with your son's matters as well. With that, I'd like to call forward Mr. Joe Benz of Protect Our Care. Joe.
Good morning, I'm Joe Benz. I'm State Director for Protect Our Care Georgia. Protect Our Care is dedicated to making high quality, affordable healthcare a right and not a privilege for everybody in America. We educate the public, influence policy. We support healthcare champions and we hold politicians accountable. We're here today to support Congressman Hank Johnson, and frankly, it's easy to do. Congressman Johnson has been a strong, outspoken advocate of the Affordable Care Act. He's protected it from attack after attack from Republicans because he understands that supporting the provisions to extend health care to young adults and eliminate lifetime caps and just the expansion of healthcare in general is critical to Georgia. He's pursued additional funding for Georgia's Peach Care program so that children in low-income families can receive essential health services. And of course, he voted for the Inflation Reduction Act, which kind of took things even further than the Affordable Care Act. It allowed Medicare to negotiate down the price of prescription drugs and make them cheaper, put out-of-pocket limits on insulin costs. And then it also extended the ACA subsidies that just made Affordable Care Act plans more affordable for millions of Americans. Unfortunately, President Trump and the Republicans in Congress don't see eye to eye with Congressman Johnson. After making claims that he would not touch Medicaid, and this was on TV like just maybe 3 days ago, he wasn't going to touch it. The president endorsed the Republicans' plan to cut between $880 billion and $2 trillion from Medicaid. This threatens a program that a lot of folks rely on. The consequences of cutting Medicaid are going to touch nearly every household in America, including the people in this room. Couldn't be said much plainer than you said about the impacts of what this is going to do and the chaos it's going to cause to systems and state budgets. Medicaid provides health care to over 72 million people. 6 in 10 nursing home residents rely on Medicaid. 30 million children, 9 million adults with disabilities, and about 14 million adults with mental illness. Here's what's going to happen if they slash the Medicaid budget. It's going to wreak havoc on state budgets and services, like I mentioned. Rural hospitals will close, and the people that rely on them will be left out in the cold. America's skyrocketing mental health crisis will be exacerbated. The maternal mortality and the maternal health crisis are going to get much worse. 31 million children who rely on Medicaid will be out of luck, and seniors and their families are going to be left out, sold out for tax breaks to the wealthiest Americans, billionaires, multi-billionaires. So by endorsing the Republican proposal to slash hundreds of billions from the country's largest health insurance program, Donald Trump is putting the health of over 72 million Americans on the chopping block. Sometimes it's hard to tell what he means and what he's just saying, but I guarantee you this. Donald Trump knows the damage these Medicaid cuts are going to cause. He knows what they will do. And he's joining with congressional Republicans, and this has been their plan all along. Gut Medicaid to give tax breaks to the wealthiest Americans. Appreciate Congressman Johnson's work, his attempts to stop this. Thanks to Francine Johnson for having us and the care that she provides for a lot of folks.
Thanks. Thanks, Joe. And next we will take any questions that you may have.
Congressman, this is Valerie Morgan on Common Ground News. Do you have an idea of how many of these personal care homes are in your district and what and how many people are within those personal care homes?
I don't know how many personal care homes and nursing homes we have in the district, but it's about 120,000 district residents who are involved in personal care homes, living in personal care homes or nursing homes, or have loved ones who are receiving Medicaid benefits for that purpose. It's about 120,000 families that would be directly impacted should these drastic and draconian cuts to Medicaid ever become reality. Anyone else?
Yes. My assumption would be that Medicaid or Medicare cuts will show up first in depletion of staff. Staffing issues are behind my problems. If I could get 2 caseworkers who knew what I was talking about when I called, that would make a big difference. There are too few of them. And I am afraid they're about to be fewer. If you call and get someone who only knows what happens generally in your situation, rather than specifically with your case, you've just wasted a call. If that person could simply transfer me to someone who knew about my specifics, that would help me a lot. Whatever Congress can do to keep staff from being depleted will help a lot of us, maybe not everyone. It would help me, it would help my son.
Well, there's no doubt that the federal agencies through which programs like Medicaid and Medicare and Social Security and SNAP are administered. Those agencies, as we speak, are being cut
Mhm.
by by co-president Trump,
Mhm.
co-president
Mhm.
Elon Musk, and his Doge group, the so-called Department of Government Efficiency. And what they are doing is just going into agencies and announcing wholesale cuts to federal employees. And so
Because making
thousands,
government efficient means having no
Well,
government staffers.
but they are not intent on finding inefficiencies. Their quest is to capture data while reducing the size of government by dismantling agencies that were created by Congress. And so uh, this is what this group is doing. Uh, it's we've been cost cutting or cutting staff at agencies for year after year after year. And with these draconian cuts that are resulting in people being thrown off of their jobs, hardworking public servants working for the federal government being sent a email terminating them as of that particular day, based on false pretenses that their work has been insufficient. Their performance, their job performance has been insufficient. And so therefore we're terminating you. And in a place like Georgia, where if you are terminated for cause, then you cannot collect your unemployment benefit. People are experiencing a double whammy. They're being fired from their job and they're being precluded from collecting uninsurance benefits. And so real harm is being done across the nation to working people and their families. And it's just that very thing, rendering services to the American people that is being disrupted while they are at the same time cutting expenditures from those same agencies. And so this is an unprecedented assault on our government by co-presidents, one of whom was elected and the other being an unelected guy from South Africa, from apartheid South Africa. It's something that we just cannot allow to happen. But unfortunately, my colleagues on the other side of the aisle in Congress, Republicans, are submissive and are going along with everything that Donald Trump and co-president Elon Musk are doing. It's very unfortunate. Any other questions? Okay, with that,
I may have not, I don't know, even though the cuts have been are being proposed, what is the time frame? Is there a time frame that's already set?
well, these are cuts that have to be passed into law. And so that is what Republicans are going to do with the passage, well, bringing to the floor of a budget resolution next week. And whether or not it can pass or not remains to be seen. But the threat is real and the possibility of passage is real. But something that people should know is that even though MAGA Republicans are in the back pocket of billionaire oligarchs like Elon Musk and Donald Trump, they represent some of the poorest areas of the nation. They hail from districts that are located outside of metropolitan areas across the country in places of poverty. And so the number of their constituents who benefit from Medicaid, Medicare, Social Security, SNAP benefits are high.
Right.
And when those people wake up and start looking at their Republican representatives and wondering why they are representing billionaires instead of the regular people, then maybe we will have some Republicans to wake up and start voting for the values and legislation and proposals that Democrats have in place. All we need is three, Republicans are operating with a 3-vote majority right now, one of the slimmest majorities in the history of Congress. And all we need is for 3 of those Republicans to switch their votes to measures that Democrats favor, which are those that would protect Medicaid, Medicare, Social Security, food stamps, subsidies for the Affordable Health Care Act, and other things that help make healthcare and prescription drugs more affordable for the American people. All we need is 3 Republicans to come over to our side, and we would be able to protect the things that Americans have come to rely upon.
Okay. Thank you.
With that, I think we will close down this press conference. I want to thank all of the members of the press for being here, and thank you all for being here as well.